Joining us in our booth now is Trapp, which I'm so happy to see you. I don't know if we ever met in person, but many years ago, probably 10 years ago, we had her as our Diabetes Educator of the Month in our magazine, where she had helped one of her patients get health insurance, or health insurance coverage for products. And so she was our hero that month. And now she's on the show to talk to us about the vegan diet and how it's potentially an excellent diet for people with diabetes.
Sure. Let me start by explaining what a vegan diet is.
That would be good.
People don't always know the word. Vegan just means no animal products and no dairy products. I want to tell you about a study that was published in Diabetes Care last year, in which people followed either a vegan diet or the traditional approach of weighing and measuring and portion control. The people in the vegan arm of the study did significantly better. They lost 50% more weight. A1C dropped 3 times as much in the vegan group, but here's the best part. Adherence was much better. People found this was an easier diet to stick with because there's no weighing, no measuring. They didn't have to go hungry. So we're really excited to be talking about this because it's a great option for people. In my own practice as a diabetes nurse practitioner, I've had people complain about the cost of medications, their health insurance is no longer paying for the medications, or they've had side effects from the medications. So they're really more open-minded about some new approaches.
And I'm so proud of, she used a word that I've been trying to think of the last 3 days. We've had many guests on that use the word compliance. The patients, we want the patients to be compliant, and I kind of bristle, and I've been adherent. That's the word we need to be hearing. And I just wanted to, Carolyn, validate you for using that word because it's much more empowering for the patient.
Absolutely.
To hear that.
I'm glad to hear you say that.
You want your dog to be compliant, but your patient's adherent is much better. So the diet, they like the diet.
They do like the diet, and we have some great resources for people who'd like to try it, and for healthcare professionals who'd like to prescribe this to their patients.
I wanted to ask, because when I hear vegan diet, I think it's going to be more carbohydrates, and that way it'll be more insulin, and my blood sugar would be I guess I was a vegetarian long time ago when it was kind of trendy and in, and so am I right or am I wrong?
Sure. It absolutely is more carbohydrate, but it doesn't necessarily mean more insulin. And certainly for people with type 2 diabetes, while they're increasing their carbohydrate because they're eating more fiber, more pasta, more starchy vegetables, more grains, they're also decreasing fat quite a bit. And when you cut down on fat, and this isn't well known, but when you cut down on fat, your body's ability to utilize insulin gets much better, and that helps to regulate blood sugars. Also, the carbohydrate that we are recommending are low glycemic index carbohydrates, those carbs that don't turn to sugar quite so quickly. So in fact, in Dr. Barnard's book, which I don't think I mentioned to you,
Not yet.
Chapter 2 talks about intramyocellular lipid, which is this whole process of when you ingest fat, how it gets inside of skeletal muscle, and it sort of gums up the work. It makes it hard for insulin to do its job.
That's why my brain is still, you said you cut down on fat,
Yep.
you cut down on insulin resistance.
Right.
That's new to me.
Yep. And it's really an important message that we need to be making people aware of, because it totally changes the approach. You know, I have patients that come to me for the first time and they say, I've cut out all bread, I've cut out pasta, because they think those are troublemaker foods. But when you look around the world, there are many cultures traditionally that lived on carbohydrates. You know, the Asians, the thinnest people on the planet, fill up on rice and noodles, right? In Africa, South America, they're eating a lot of carbohydrate. And traditionally, unfortunately, we're exporting our Western diet so much that that's no longer true. But by looking at some of those more traditional diets, by following this approach, it really is possible for people to cut down on medication and sometimes even get off of medication. So can I tell you about our website?
Yes, because I was just going to say, when people are watching, if they want to know more.
Sure. They should come to our website. It's pcrm.org. It's the Physicians Committee for Responsible Medicine, pcrm.org. And you can request our materials in bulk at no cost to share with patients.
Terrific. Carolyn, thanks for coming on the show.
Thank you very much,
and
Scott.
showing us your material, and it's so good to see you
My
finally meet
pleasure.
you after being our
great.
Diabetes Educator of the Month so many years ago.